Joining us this morning from Sparrow Hospital, we have Dr. Michael Keddy. Good morning, doctor.
Good morning. Thank you for having me.
February is American Heart Month, and we know that Sparrow Thoracic and Cardiovascular Institute is the leading cardiac practice in mid-Michigan. So you're probably getting a lot of questions about the COVID vaccine for cardiac patients. What advice are you giving people?
Yes, it's an excellent question. And a lot of my patients are actually anxiously waiting in line to get their vaccine. But we know people with cardiac disease are at a higher risk of developing serious complications from COVID, including death. So anything we can do to prevent a serious infection. So things we're doing now, wearing a mask, social distancing, and getting the vaccine when it's available. So I highly encourage my patients to receive the vaccine.
I'm curious, how does COVID-19 affect the heart?
So people with a mild infection who are able to recover at home and not go into the hospital don't seem to have any long-term impact on the heart. Now, people that get admitted to the hospital and require, high amounts of oxygen do show signs of heart stress or heart injury. And if they require mechanical ventilation or more of a serious infection, they can get direct inflammation of the heart muscle, and that can lead to congestive heart failure or weakened pump or squeeze of the heart.
Do you have any advice in general on maintaining a healthy heart?
Yes. So big thing is staying active and exercise. So we typically recommend about 150 minutes of aerobic exercise a week, and that boils down to about 30 minutes of activity 5 days. So that includes things like brisk walking, biking, doubles tennis, dancing, water aerobics, things like that, as well as eating healthy. So avoiding high amounts of carbohydrates, which everybody loves, the breads, the pastas, the sweets, the high sugary drinks, and focusing more on things like fresh fruits and vegetables, lean meats. Try substituting the high sugar drinks with a sparkling water that's flavored, things like that. Another big thing is treating underlying medical problems, things like diabetes, high blood pressure, high cholesterol, because getting those adequately controlled does prevent serious heart disease in the future.
Good advice, doctor. Thank you so much for joining us on The Blend.
Yes, thank you so much for having me.